Hey everyone, welcome back to the arena. This is MD, joined by Covey. Before we get into our conversation and learn about our special guest here today, wanted to first and foremost thank everybody who takes the time to, or who has taken the time to give us a listen, say something positive, tell a friend about it even. I think we're starting to get some word of mouth motion in place, which is really cool to see. People we've never met before, I've never met before. Kind of secondhand communication there on this getting out and having some sort of positive impact. So really appreciate all of that support, and pass it over to you, Kobe.
What's going on, everyone? So I'm going to introduce our third guest now. This is someone actually just got back from where I met this person. Her name's Hannah Massey. I met her in improv, so 9 weeks ago, right?
Yeah.
Something along those lines. And so that's been the whole improv journey is another story for another day. But I think Hannah has been super open in my conversations so far, kind of aligned with a lot of the values that we kind of preach on this show. And so I think you guys are really going to enjoy the conversation with her today. Without further ado, I'll let Hannah introduce herself, provide a little bit of background on kind of herself, how she got to where she is today, and we'll just take it from there.
All right, thanks, Matt. I appreciate it. Appreciate you guys letting me hop on your show. I think it's really awesome what you guys are doing and the messages you're trying to promote, especially from like the male perspective with mental health and self-help. But I am graduating from chiropractic school in 4 weeks now. Super exciting.
Wow.
I'm very ready to be done. But that's where like my formal training is in that. But I also am getting a kind of a specialty degree in clinical neuroscience. So what that means is I'm taking kind of a holistic approach to brain injuries and rehabilitation through the work that I'm doing.
So what exactly does that mean? Because you've probably explained it to me like 3 or 4 times now, and I still leave with a little more clarity, but also like, okay, what exactly does she do?
I think I could take a stab. No, I'm kidding.
Go for it. What does that sound like to you?
No, please. I was just making a joke more than anything, but...
No, I mean, so it's kind of a new field. Like a lot of my colleagues, even in like chiropractic, I've had teachers come up to me and being like, "Oh, you're the neuro nerd." And I'm like, "Yeah, kind of." And the teacher's like, "Explain it to me. How does it work?" So it's a new field. I didn't know going into chiropractic school that you can get specialties just like you would if you were going through a traditional medical program. So we have like sports rehab specialties, we have pediatrics, we have internal medicine specialties. So I'm doing the track that's in neuroscience essentially. So what that looks like is once I take another boards exam, I'm a Diplomate of Chiropractic Neurology, meaning I'm equipped to treat various neurological diseases and conditions and brain injuries. So how does that differ from like a medical neurologist is kind of a big question. So without like trying to put them against each other, like one being better than the other, they're just going to take different approaches. So if you had some kind of neurological disease or neurological symptoms, maybe you had like a brain tumor or something, you might go to a neurologist or a neurosurgeon, and the options are like a medication to affect your symptoms or maybe surgery. Well, what we do is kind of in the same model as chiropractic, which is a little bit more holistic. The job is kind of empowering the patient to take healing in their own hands. So I speak for, I think, the majority of this profession, but we are founded on the principles of neuroplasticity, which means the brain is capable of changing, of making new connections, new synaptic connections, and changing. We're not plastic. We're elastic. We can adapt and grow. So it's taking someone's whatever signs and symptoms their brain is struggling with and giving them maybe exercises or rehab exercises to target the areas of the brain that aren't working as well. So this form of therapy can be applied to conditions that range from concussions. We see a lot of concussions, to POTS, if anyone's heard from POTS. That's a form of dysautonomia, which is a fancy word for saying dysregulated autonomic nervous system. We see a lot of long-haul COVID patients, neurodegenerative conditions like Alzheimer's and Parkinson's, and stroke victims, as well as I work with a lot of kids who have like autism and ADHD, sensory processing disorders. So a long list of stuff. It's kind of a free-for-all. Like, we've seen patients who have really terrible depression, and we're working on trying to increase the integrity of those centers that are depressed. So there's a lot of different things we can do.
Let me ask you a couple of things there. One, are you anti-medication? Because that's kind of the sense I get for this approach. And two, are patients generally receptive to this type of treatment?
Yeah.
It sounds like you said like it's a newer framework. It's a newer,
Sure. First off, that was kind of a joke. The anti-medication was kind of a joke, but also like. That's a nuanced question. First off, it is not within my license or scope to prescribe medication, so we can't as chiropractors. Technically, we can't give medical advice either, meaning we couldn't tell someone if they should or shouldn't go off their medication. On that end, their medication is used as a Band-Aid sometimes. Sometimes it's prescribed when maybe it's not the best fit for someone. It's just kind of an easy fix. So it's kind of nuanced. Like, some people, people who have issues with their blood pressure, they need to be on a blood pressure medication. There's a time and place for medication. Yeah. So it just kind of depends.
So the difference, between the neurology on the medical side is pretty clear. It's without medicine, but you mentioned it's a form of therapy.
Yeah.
And so, what's the not the better question. The other question is what's the difference between your field and a therapist? And my assumption would be you're dealing with more actual disorders or brain diseases versus maybe a therapist is dealing with something less tangible.
Is it less acute? Is talk therapy less acute then, generally, or is it?
Let's see, less acute. I would. Well, so it's kind of just targeting it's a different type of therapy. Let's go with that. So it's less of, while we might spend time talking with our patients and trying to uncover some of those blocks or emotional issues that might be contributing to their symptoms. When I say therapy, I think of it more like physical therapy for your brain. So we're going to give them specific exercises, whether it is more physical exercises, or, for example, there might be eye exercises, because the eyes, different centers of the brain, control eye movements. So sometimes we give them simple eye exercises that are going to help strengthen.
What's an eye exercise?
Do you have any nose exexercises to get smelled at? Because I don't have my smell for 2.5 years.
Stabilizing, using. Okay, let's go down this rabbit hole. So let's say your visual system is connected to your vestibular system. So your vestibular system is like your inner ear. It's where your body is in space in relation to gravity. So for example, with concussions, usually those two systems are affected. Thank you if you, were you athletes in past lives?
Yeah. Current life too,
Current life, yeah. Okay, to be fair. Football players, they are probably the ones, when you think of concussions, most commonly affected. So a blunt hit to the head, that can have these downstream effects of causing you to have trouble orienting your body in space. You might have light sensitivity, sound sensitivity. You might have migraines. Long story short is we can use the visual and vestibular system to help improve those areas in the brain that aren't functioning as well, to try to simplify it.
No, I think that's a great.
So it's a little bit different than talk therapy. However, we can make improvements to mental health through working on those areas of the brain.
I think what's cool is you said you can, and you hear it. I think I've heard it on plenty of podcasts from people. Is like you can literally rewire your brain, and I think that often goes overlooked by people. But it's like true. Like meditation, for example, is something I just started, and they had like at first I'm like, oh, meditating, like that sounds so, I don't know. There's a stigma to me associated when I hear the word meditating, or when I used to hear the word meditating. I don't even know what the stigma is. I just thought of negativity, right, or weird, right? But when someone told me it's like you're training your mind, right, to be more present in like focus, I think that was super cool. The fact that you can actually change the way you think because your thoughts are so important and they lead you down. So I think that was super cool.
Yeah.
So I guess, are there hard-hitting kind of like, how do you take your job, or how do you not take your job and bring it with you outside of it? Like, are there...
First, like, what got you into all that? And then
Sure.
I would like to get to that if we can. Is this like a passion of yours? Is there a story behind it?
Yeah.
Like, what made you get into this
Oh boy.
what feels very specific?
All of the above. Let's see. So I guess to get into chiropractic in general, which will translate to how I got into this like weird world of the brain.
Not weird, interesting.
Interesting. Well, we all refer
Weird
to
is good.
ourselves.
Weird
We're kind
here,
of
weird is good.
doctors. Yeah. So in my early 20s, I had a lot of health issues come up. I don't like overusing the word trauma because I think it's like, some people blow it out of context. It's like kind of the new hot word to talk about our traumas. But I had kind of a series of events that happened early 20s. One was a really bad car wreck, and I had a lot of like chronic pain and just weird symptoms that did not fit in any box that any doctor could help me with. And it was a really hard time. We all have things that affect us significantly. We all have traumas. We all have these things that have defined us as who we are today. And this was a period of my life. In your 20s, you're just getting out of college, early 20s, you're trying to figure out who you are, and a lot of that during that time frame was I'm in pain. Like, that was how my identity was shaped. And then I started working with a chiropractor, and I realized that was one person of all these doctors I had been to who like instilled hope in me. And so that's kind of how I got into chiropractic school, because I wanted to do that for other people. I've always loved helping people. I've always loved kind of doing what you guys are doing, like listening to people's stories and learning from people, and I wanted to do that. And I didn't know going into chiropractic school anything about the subspecialty of the brain, but when I started we have to take in our curriculum neuroanatomy classes, and once I started learning about the brain and how it functions, how it amplifies pain, how information from your legs goes up to your brain and vice versa, like how all these symptoms work, I was like, I want to study this further. I want to help people with these weird symptoms like I had. So then as soon as I got into it and started studying, I knew this was exactly what I want to do. We have people that come to us usually on their last leg of their journey. They come to us desperate for help of like, I've seen all these doctors and no one's been able to help me. Like, you are my last resort. And it's so rewarding we can't always completely fix people, but like seeing someone who is that desperate suddenly start to see hope that they can get a little bit better is incredibly rewarding.
So was there like a 180 transition? Because you mentioned this was after college. So what were you studying before that, and like how much of a transition was this to start? I would feel overwhelmed if you told me after college I have to learn about the brain, and like, you know what I mean? Like, I would think you'd need years of schooling, right? So like,
yeah, after college, I personal trained for 4 or 5 years, and I think I was just talking to Matt about it. I think although like I'm not really doing anything with personal training these days anymore, working with people in itself teaches you a lot of like life experience. I learned boundaries between like work and home life. I learned a lot about people, of like what drives them, what breaks them, and I feel like I've been able to take that into my practice currently of like doing this whole, I guess we call it like neurorehabilitation work. But also like, I think I've always had, and I don't want it to come across like I'm bragging or something, I always feel like I've had a really good work ethic. So I think like chiropractic school was a daunting task. You're studying all day, every day for 3.5 years. But I think it was little things along the way that prepared me for this. Like I was a dancer growing up, and like that is, you have to have a ton of discipline to want to pursue. This is another tangent that has somewhat to do with all those like traumas that happen, because the health stuff affected my ability to dance. But that discipline, working, having my own business as a personal trainer, I think all of that prepared me for the discipline to just like try to go all in at learning as much as I could about the brain.
Yeah, no, and so, because I remember the first time I talked to you, I was like, you know, what do you do? You told me, I'm like, I don't know what that is. But
most people don't. It's okay.
And then I asked you, like, my next question was, do you like what you do? And your response was, I love it,
Yeah.
which I was like, wow, this is inspiring. Finding people that love what they do, you do too, right, for the most part, which I think is super inspiring. And I think it's really cool that you took basically what it sounds like are some of your darkest times and use that as fuel to figure out your passion in life.
Yeah.
And so I guess my question would be, like, how were you able to continue just going and continue that drive, and even when it sounds like you were super active, right? You were a dancer, personal trainer, clearly into fitness, and then to have something come up that basically doesn't allow you to do those things, because I've dealt with it on a much smaller scale, right? Like having a knee injury that keeps you out for 6 months, of someone that really wants to be active, and even then it's like you really have to work through that, and it's hard. So I'm just curious, like how are you able to keep going, and just kind of accept that, you know, some parts of your life might not be the same.
I mean, to be honest, I didn't. Like, that was the darkest time in my life. I mean, I was a dancer wanting to go to Broadway and do it professionally, and I had this weird ankle injury that took me out of it. So I was kind of having to distance myself from everyone affiliated with dance. I had to, after that injury, like, I had a car wreck, and I was just in the worst shape I've ever been in physically and mentally because of that. So it was a very isolating time. I don't know how like dark we get on this, but like depressed and suicidal, off and on for years. And
so like, I guess my question is, what kept you going? Like, what was the driving force?
Well, that's the thing, is like I'm saying this because I think this is real. Like, I did it for a while.
Yeah.
It was just, my goals for the day were to just try to keep going off and on for years. And for me, I think like that's the best some people can do at some points. Like when you're at your lowest, it's not like you can just flip a switch and get out of it. Like when you're in a situation, you have to kind of grieve it and let time do its thing. So it did. Time passed. I was like, all right, I'll be a personal trainer. I'll try to do something physically active to keep going. I did it. Didn't love it because I was still kind of miserable mentally and not doing well. It was just kind of taking slow steps to try to get out of it. I did start seeing a therapist, and I think it was 2018. Right away, that didn't fix all my issues. That was also a long process of slowly becoming more comfortable with her, slowly realizing kind of just all the issues I had been battling for the past 25 years, not necessarily even related to the injuries and the pain, but it was slow steps in that direction. And it really wasn't until, honestly, I started going to chiropractic school where I could kind of have that 360 moment of, I can't save that 20-year-old Hannah who was depressed and just had given up everything, but I can help other people who are dealing with similar things. And it was when I had that 360 moment when I think I stopped playing like the victim in this story of all the things I couldn't do, because I was able to see how I could use this to help other people.
So, you have something to say?
Well,
I've got a lot I want to
yeah, there's a ton. I mean, I
Sorry.
No, not. No, there's
in a good way. We'll just have to find a way to cover all of it. But just for me to as I get to know you, this is the first time we're meeting, right? And as you talk about your all-time lows, not too long ago, was it physical fitness or just physical ability? Was that a core value of yours? And like being in a car wreck, taking you away from dancing, taking you away from being in your tip-top physical shape.
Yeah.
Was that like one of the main drivers to bringing you to your valley?
You're saying, just making sure I'm hearing you right, valley meaning like
your
my
all-time
lowest?
low. Yeah.
Oh yeah. Yeah, dance was everything to me, because in like an unhealthy way too, of like every day and this is just kind of how I am. This is how I was with studying the brain, that like discipline. I'm very kind of just like, when I set my sights on something, I'll do everything I can to get me there. So I was waking up every single day with Broadway in the back of my head, like dancing, all day, every day, doing everything I can, probably sacrificing mental health to try to achieve these highs. So yeah, when I had that taken away, I crashed for sure. And at the time, and crash is probably putting it lightly, at the time I didn't think I could see anything else, like anything else would fill that void. And it was after, again, I think time heals. I had some time of moving past that when I could find other physical outlets that gave me that same feeling. Whether it was I got into powerlifting, which I was like 115 pounds when I like stopped dancing, and to be able to lift all this heavy weight, it was so empowering to me. And like that exercise fills that void, improv fills that void.
Well, now it's not dancing, but it's improv.
Yeah.
You're going
So
to the big stages.
So there was a dream attached to it,
Yeah.
right? And I think that's probably in some ways what could have hurt the most, but perhaps behind that dream was a value of physical ability or physical fitness, and you found maybe other ways to channel it or exercise
Yeah,
it.
sure.
Powerlifting and dancing are two very different things, right? But I think healing your body and getting to a place where you could accomplish something physically seemed to help fill that void. Am I understanding that correctly?
Yeah, absolutely.
So I want to ask you something, because I've been thinking this about a lot for myself recently, is like what I struggled with for a long time was, a huge place of shame for me, like hated everything about it. Then I got to the point where I kind of accepted who I was. I still wasn't proud of it, but I accepted it. Now I'm at a point where I'm prouder of it, and I'm still working through it, but I'm confident in who I am, and I'm proud of who I am, and I've gotten to the point now where for the longest time you could ask me, and I've been like, when it comes to sexuality, of like, I wish I would have been different, or I wish I didn't have to deal with this. Like, why couldn't I just been straight? It would have been easier. You know what I mean? Now I'm actually kind of grateful for it, because I would not be the person I am today if not for that.
Yeah.
All of having to go through all that.
Yeah.
So my question to you is, do you wish that you didn't have to, or do you wish you didn't have to go through what you did? Or, if you could take anything back, would you? Or, as it relates to your journey?
Yeah, those are good questions. No, I don't think I would take anything back, though it was really, really painful.
Yeah.
For various reasons. But I agree. I'm trying to think of what you said because you had a lot of good thoughts. I feel like I'm way more sensitive to my patients when they come in and present the physical and mental barriers that they have. It makes me connect with them a little bit deeper, and I feel like they are able to connect with me as well and put trust in me because they can see that even though I might not be saying like that I share their burdens or like I've been through it too, it's like they realize by how I'm responding to it that I get it, and they feel safe with me, and they're more trusting in my abilities to help them. Let's see, you said what else?
Yeah, no, that was really the crux of my question, or what I wanted to hear from you is, like, would you have, if you could have, would you have not gotten in that crash, right? Or whatever it was that limited your ability, or that kind of put you in that dark place. Because like I said, for me, it was like, for so long, I'm like, God, I wish I didn't have to deal with this, or I wish I could just be this way. But now I'm grateful. I'm happy with who I am, and I'm grateful for it because it's molded me into this person that I wouldn't be if not for that.
Yeah, no, I definitely think, do I really want to relive it? Probably not,
right.
But I think it's for the best. I'm really happy with the field I'm going into, and it
you
just...
might not even be doing what you were doing if not, right? Because that kind of drove you to, it sounds like, to get into chiropractic and be so interested in the brain.
Mm-hmm.
Well, I always say, like, your best lessons in life are learned when you're going through a failure or going through challenge or adversity. You know, you don't learn a whole lot from winning necessarily, and I think we think adversity is good for people in that sense. Mm-hmm. It's not so much, I'd love to go back and do that car wreck all over again, right. But there's a level of adversity that you've grown beyond, and you're just an improved person from the lessons learned. Yeah. But what about you? Because Kobe, I know you, I've watched you go through a few injuries. One that took you completely off your feet for months, the ACL. That bothers you so much in similar ways that it bothered Hannah, in a sense that maybe there wasn't a dream attached to it, but that's what I want to ask you. You're bothered because I'm going to fall behind on my physical goals, my fitness, and my routine, and it really bothers you. Like, it eats you up. Like, I don't talk to you for, like, until you're on your feet. But, like, is there a dream attached to all this for you, or, like, what is there a dream anywhere attached to?
No, when it comes to my physical fitness, it's more, I think for me, it's more confidence related. It's like, first of all, it's such a habit, and if I physically can't work out, I don't feel, one, as good about myself. I don't feel as confident in myself. I don't feel that I've accomplished as much. And it takes a lot of discipline, so I credit you to stay off your feet, even though, like, for me, there were times where I wanted to kind of push ahead of where I was at in the rehab process, but it took a lot of discipline to say, okay, like, I need to stay the course here. Like, this could lead to, broader damage. What I'm dealing with right now in my foot, I got reckless and I did something I shouldn't have done, and look, it set me back, right? And so it's taught me a lot more about life, more broadly, and just continuing to stay disciplined even when you really don't want to, right? Because there's nothing more that I enjoy doing than being active, and to have something that takes you out for so long. It's more just about it just makes me feel good, and when you're not able to do that for a prolonged period of time, it definitely hurt me more mentally, right? Than physically, like. Yeah, I still want to look good and feel good in the process, but it definitely hurt me more mentally.
So, at any point in your life, have you ever had a dream stripped away from you, would you say? Because I'm trying to wonder if Hannah might be the only one in this room that has gone through that.
Yeah, I mean, not through an injury. I wanted to be a basketball player, but that was skill related,
Reality.
I mean, what are your thoughts on kind of that more generally?
I mean, I remember when it happened, and so many, or like when I stopped dancing, and like my whole world changed. But also, everyone in my circle like knew about it and knew my dreams to be a dancer. So the reactions were really interesting. So many people would try to relate, of being like, "Yeah, I know what you're going through because like I don't dance anymore either." I'm like, but there's a difference, because you chose to stop dancing for whatever reason. And I didn't. Like, it was taken away from me, which sounds really dramatic, but that's how I felt at the time.
So what would you have needed to hear? Because I think that's actually a really good point, is you say something to someone and their reaction is they want to bring it about themselves or they want to try to relate to it, when my guess is you probably just wanted to hear like, I hear you, like, you know?
Yeah, exactly. I didn't really know what validation was until like, you know, 4 years ago or so. Like, I don't think I had been in relationships where, this is gonna get deep, but like my needs or my emotions were validated. That was not something that I experienced growing up. So like in those moments, I probably needed more people to be like just upfront with how much that sucked for me. I didn't need necessarily a pity party. I just needed people to
crawl
be
in the
present.
hole with you.
Yeah,
right?
I needed people to be present, and I didn't really have that. I had, you know, there's a lot of, there was a joke in improv today about toxic positivity during the pandemic, and like I had a lot of that.
What's toxic positivity?
That's dismissing your problems of like, oh, you hurt your ankle, well, at least you can still like get a degree. Like at least you're not like able to not work. Like it's dismissing what you're going through. So the example today was like the teachers during the pandemic who are losing their minds out of all the protocols, and they're saying, oh, it'll be fine. Like we have these policies in place, like just go for it, it'll all work out. When it's dismissing the obstacles or the stress you're under, because someone just doesn't have the time for it.
We should look into that more. Toxic positivity is, I think, a really interesting topic.
Yeah, it's like the person that's just always trying, it's almost like forcing the glass half full perspective, but simultaneously dismissing something that in almost like an unempathetic way.
Yeah.
Right? Well, I think the key word of what you were saying is you needed someone to just like empathize with you. Like I read some Brene Brown, and she had a story, and basically the analogy that got to me is like, I don't need someone to tell me it's okay. I need someone that's going to crawl into that little hole that and just be there with me, right? And stay there.
Yeah.
So I think that's great.
At the same time, the one thing, you know, I was reading this morning too, Mark Manson, and he talked about, and this one really hit home for me, but for you, I want to ask you, because there's this idea of fault and responsibility, kind of blending together, but really they're different, right? It's not your fault that you went through, you know, some physical horrific incident, right? But at the same time, it was your responsibility to respond in a way that's going to get you back on your feet. And it sounded like there was a gap of time where when you're not taking responsibility and something has happened to you that you feel is unjust or out of your control, is your fault, you victimize yourself, right? Yeah. You were the victim of that, right? Yeah. But I think there's something to be said about, are you going to continue to victimize yourself and woe is me? And was there a gap of that time? And then was there an inflection point of like, nobody's going to get Hannah back on her feet more than Hannah is?
Yeah. I think, in my opinion, there was a healthy amount of time for me to be in that mentality in the beginning, because it was just a lot of change at once, because the ankle injury happened, then the car wreck happened, some other stuff happened. In my world, I couldn't take care of myself. I was always in pain. There was a lot that's shifted. So I think there's like a time and place, not necessarily saying that the victim mentality was appropriate, but there was a time for me to like feel that sorrow and that loss. And there was a time when I didn't really know what to do next, and it was kind of just going through the motions. I was getting out of bed. I was trying to work. I was emotionally unstable and sobbing my eyes out, but I was still going to work and trying. And then there was a time when I started going to therapy of saying, okay, I'm done playing the victim and I need to do something about this. I don't want to live like this anymore. And for me, I think the timeline was appropriate, but I think everyone's different. Like, they need that time to be present with their feelings, to be upset, to be mad. Whatever, anger and being mad is not bad. It's when you take that anger out on someone else. So it's justified. It's just, it has to be contained. So I do think there was a lapse. I think for me, like, I needed some time to grieve it before I wasn't ready right after that to be like, okay, I'm over it. I need to get back on my feet now. Like, I had to kind of feel the magnitude of it for a little bit.
I think everyone's kind of on their own timeline. Like me personally, first I had to be self-aware of who I was, and then once you accept it, it's like, okay, accept that this is your life, which this was your new life, right? Like, there were certain things that you couldn't do anymore, no matter how badly you wanted to, and then you have to kind of process that, and then, I mean, for me, it was kind of a flip of a switch of like, Mark Manson says really well, like, this is my responsibility. Nobody's going to change it, who I am. Like, I need to work through this. So I guess on that, because I love that you brought up therapy, and
and therapy was her response, right? Because you choose your response. You're responsible for how you respond to events. I'll go right back to you, but therapy was, it seems like, part of your response, which is awesome to hear.
Did you get, so on that point, did you get recommended to go to therapy? Was it just something you took upon your own? Like, was there a stigma associated with therapy? Because there was for me, and I actually got recommended to it by my sister, and I was like, well, I'm already down in the dumps. What else, why not try it? But just curious if you had any sort of stigma associated with it prior to getting it. Did someone recommend it to you? And then just kind of what's your experience been?
Yeah. So my first instance with therapy came, I guess, while I was still in college. So I would have been 19 when I was going through some other things that might have because of the mental battles I was dealing with at this time. It obviously didn't cause the car wreck, but knowing what I do now about injuries and the way that stress can make you more susceptible to injuries, I definitely think it fed it, and kind of made that perfect storm to allow that catapult of health issues to arise. But I had tried a therapist, it didn't click. Just didn't work out, and that's natural.
That's interesting, because I actually connected with mine, which I think my first therapist is pretty unique.
And it could have been that therapist, that we just didn't work together. It might just be I wasn't ready at the time, and I think that was the latter issue of my mother was telling me to go. I didn't really want to go. She saw it as that I had one issue, and I saw it as that it was another issue that I was having that needed to be addressed. So the first therapist didn't work out. The second time around, I consulted kind of an older friend of mine who happened to be a pastor a pastor, and I was just like, I don't know what else to do. I'm at my wit's end. I need help. And so he gave me some names of therapists, and that's how I found mine.
And how's your experience been?
It was good, but it's not it wasn't a linear progression by any means.
For sure.
It kind of looked like this. I met my therapist. I'm very guarded, so with everyone, even though I'm pretty open in this setting, in an intimate setting, with dating or just close friendships, I'm pretty guarded. So it took me probably 6 months for me to even bring up the root of my issues to my therapist. It was I was kind of treading softly on those hard topics and let's talk about anything and everything other than the issue I need to work on.
Really?
So you were deliberately doing that? You knew?
I just didn't want to be vulnerable.
Sure.
It made me really uncomfortable for someone else to sit with my hard stuff, which kind of makes sense if no one had ever done that for me before. If my emotional needs were never met, to me, it makes sense of why I would be so guarded on opening up to someone. So it wasn't until I was able to tackle that head on and bring up what was bothering me until I saw some progress. And it wasn't a night and day difference. It was slow and steady. And timeline was 2018. I started seeing her I think it was twice a week. And then by 2020, it was probably once a month. And I still see her virtually 1 to 2 times a month. But it was slow progress, and it was it started focused on my physical health, but then we would slowly peel back layers of how my relationship with my family influenced my physical health, and all the other like layers that were affecting my mental state. So we've covered a lot. Like looking back now, it's been 5 years. We've covered a lot of ground. And she even brought up, I saw her on Friday, and she even brought up just like discussing my progress with me of like just something we were working through with my family of how before, maybe like when we first started talking about my family, I wanted to bargain with her about kind of like the way they were maybe treating me.
I can relate.
Whereas now I'm more in the stage, and she discussed like the stages of grief. Now I'm kind of like angry and sad, and I'm better about making boundaries than wanting to bargain for wanting to keep the peace and bargain with them.
So like showing up to therapy is perhaps only half the battle at this point, right? And what I'm hearing is like once you're there's a whole other battle to be fought, which is one within yourself to be vulnerable. And that, I think, for anyone who listens and are hesitant to go to therapy because they are maybe guarded, as you put it, maybe help shed some perspective on, I don't know, what that feels like, why you're guarded, and what you have to go through. Like, why were you guarded?
And how did it feel once you actually were vulnerable?
Yeah,
right.
So you were guarded. So what was that like? Why were you guarded? And I guess, and then how was that breakthrough?
I mean, I still have issues with being guarded. I don't know, how familiar are you guys with like attachment styles?
Oh, I'm somewhat
Okay,
familiar with
so
Like identity attachment? And...
like attachments to your
avoidant.
Yes.
Yeah.
So attachment styles are the ones you have with your caregiver at birth. And depending on how your caregiver responded to you when you were upset and crying as a baby, but also it's been talked about how it could be like later through adolescence, and just how present your caregiver was, how the theory is that it affects all your relationships from here on out, unless you go to therapy or try to break down some of those insecure attachments that you might have. So like for me, if my caregiver wasn't always maybe emotionally present, that's going to cause me to not really trust people and kind of retract and stay inward, turning to myself for comfort and validation, because I don't feel like I can get it from other people.
That's the avoidant one, right?
Yes, I'm avoidant. So, which is super fun when you're dating someone with a different attachment style.
Well, this is crazy
Do
because
we know what the styles are? Like,
the other one is, I think, is more of what I am. I'm not sure.
How many are there?
I think there's
3.
There's
3.5.
So you can be secure.
Yeah.
Apparently 50% of people have secure attachments. I don't meet that many people who think they have secure attachments, but it's secure. And then the insecure ones would be anxious, ambivalent, avoidant, or disorganized. And each of those 3 are just a little bit different in the sense of how the caregiver interacted with them. But it basically, all the insecure attachment styles just mean that the caregiver was not fully present in a certain way. If it was emotionally or physically, or maybe the caregiver inflicted abuse onto them.
Yeah, that's interesting, because I was not familiar at all with those different styles until recently, when I was like seeing someone, and I was actually talking to my therapist about it, and she introduced me to these different attachment styles, and she's like, does this kind of like who you're describing kind of sounds like they've got a little bit of an avoidant attachment style. And then it all kind of like, it made it validate. And then she's like, you actually sound like you're more on the other end. And she's like, these two often like end up together, and it ends up being very.
End? What's the other end?
What's it called? The
Anxious. Yeah.
Anxious
So
one.
you're anxious, and
I
the
think a
other
little more
person's avoidant.
anxious, and they were more avoidant, and so those two I think often end up together. You're naturally attracted to each other, and it creates a lot of conflict. And like when you do have like disagreements or stuff like that. There's just two different ways of dealing with the problem.
Yeah, I can give an example if that would make it clear. So like, I also have anxiety, but like this is a different type of anxious.
Yeah.
So like my understanding of it is someone with a more like anxious ambivalent attachment style a lot of it comes out during conflict, right? So during conflict, if you're fighting with your significant other, an anxious ambivalent person is going to need a lot of reassurance. They're going to need a lot of closeness to make sure their partner is still there and is still with them. The avoidant person during conflict, they're going to detach. They're going to want space. They might shut down. They might need to go somewhere else to cool down. But see how that doesn't mesh well? If someone's saying, I need closeness, and the other person says, I need space.
Very obvious, yeah.
In relationships, I've dealt with all that because I'm the one that's like, I shut down, I need space. I can't give you the closeness that you need right now.
Yeah, no,
Working on that.
Is that the same thing that like Jay was covering at a show? Which...
oh yeah, we saw Jay Shetty. I'm actually rocking the Jay Shetty concert apparel here, but we saw him, me and MD,
you know
on
what I'm
Tuesday.
talking about?
Yeah, no, he was talking more about, I think, like fighting styles.
Yeah.
In which it's different, but it also is similar in a way, right? I forgot the different fighting styles he had. There's someone that wants
hidden.
Yeah.
There's the one that wants to figure everything out right here and right now.
Yeah.
Like that one sounds like an anxious bucket.
That's more me, right?
Yeah.
Than anxious.
Of like needing that reassurance, but probably hence the reason why they're trying to solve the problem right there and then. Whereas I think I'm the one who needs to take like 2 business days of space.
There was someone that needed more space, and then there was also someone they called like something more like emotional, like they scream, like more like talkative, like they needed their emotions to be heard. Was like the other one. And
that one sounds like the most unproductive one, in my opinion.
I think they're all unproductive in their own way, right? It's you just need to figure out, like Jay actually said, like he's one style and his wife's another, and they've recognized it, and so they kind of split in the middle, right? Jay wants to figure everything out right there, and then his wife wants like 2 days of space, and he said they kind of compromise on like, okay, I'll give you a day, so he's at least not waiting too long, and she gets a little bit of space.
I guess I called the one unproductive, and then I'm sitting here thinking, like, what's so productive about me hiding?
Right.
So
or me just peppering someone, like, no, let's make this work, let's figure it out, So we're kind of coming up here, so, one, thank you so much for doing this and being so open. That's exactly why I wanted to have you on, so thank you. I'm going to have a few rapid-fire questions here for you.
Sure.
So,
well, one thing, real quick. Where are you now? Like, in terms of happiness, are you?
Good question. Yes,
good
question.
Yeah, we got to know if Hannah's happy.
Are you happy right now in the most deep, real sense?
And for clarity here, whatever definition of happiness you want to go by, I think I have my own. Everybody could have kind of their own and how they define it at least.
Yeah. I mean, in my eyes, I think happiness is a conditional term. I think in regards to like how I'm doing mentally, like I have good days and bad days. I let my stress creep up and affect me. I struggle with obsessive thoughts, even all these years in therapy. Like not all my issues have been fixed. We just talked about this lifelong journey. Right. And right now we're trying to tackle some of my OCD tendencies, and like that's an issue for me. I've got some family issues that also kind of easily bring me down, but when I'm in bad places, I can remember that this is a temporary feeling and the next day might be better. So overall, like I love what I do, and I am optimistic about the future. I know it always won't be smooth sailing. That's life. Like there's a lot of awful things that happen to us during our lifetime, but there's also a lot of good things. So I'm happy. This is great. Yeah. Like we had improv today. That's always a blast. But yeah, like I'm content with life, and I'm excited for the future, and I'm hopeful as I continue to work through my own issues. I'm hopeful for what will come out of it, and eager to use that to help other people.
Yeah, that's a great answer. I think someone else actually on the show that we've had on before said, like, you probably think I'm the happiest person ever. but I'm not. But I am extremely grateful for where I'm at, and I think that was really powerful because I think that's how I would describe myself, right? I don't think I'm the happiest I've ever been, but I very overwhelmed with gratitude lately, and that's to me a really cool feeling. So now we're gonna go to the rapid fire questions.
Oh boy.
Just kind of answer off the top of the thing, improv style, off the top of the head, short-ish answers. I mean, you can talk as much more or less as you like, but okay. What's the best piece of advice that you've ever received?
Oh boy.
Or just a general piece of advice. Doesn't have to be something that someone's told you specifically.
I think this can, going off of my comment on toxic positivity, this can be easily construed as that. But I had a really close friend of mine, older friend, who died of cancer when I was like early 20s. I remember we had this relationship. Is this allowed?
No, go ahead.
This is
Let's
quite
hear it.
rapid fire.
I'm interested.
But, she was dying of cancer, and I love this woman to death. I would go visit her, and this was when I was not in a good state mentally. And she was so concerned for me, even like as she was dying of cancer. And I just remember going to her and be like, I don't know how you are so happy. Like, how do you have all this joy and positivity as you're dying? And she would just say, like, I'm blessed. It could be worse. And it can always be worse. So kind of as Matt was saying, I don't run my life by dismissing my problems. I think it's very important when I'm feeling whatever it is, burnt out, exhausted, mad, frustrated, hurt, I want to address that head on. I want to figure out why I'm feeling this. But when it's something small, sweating off the small stuff and saying it's okay. Yeah. Like I am blessed. It could be worse. So that's always something that's kind of wrong in my head, especially with just some of the smaller things that can bring it down. That's
powerful. Okay, this is my favorite question. So, if you could have dinner with anyone in the world, dead or alive, who would it be and why?
I still don't know an answer to this question for myself, by the way.
I've got a couple in my head.
I'm just giving you some time to think. You're welcome.
I mean, in regards to like celebrities, I don't.
Doesn't have to be. I mean, it could literally be anyone.
Maybe Lin-Man. How do you say his name? Lin-Manuel, the writer of Hamilton. Have you guys seen Hamilton?
I haven't, but okay.
Okay,
Lin-Manuel.
Yeah, he's this like artistic genius who's written a number of Broadway shows and stuff. If you haven't seen Hamilton, Hamilton's this like great Broadway show about just like one, it brings up gun violence and like cultural barriers, racism. It's very like realistic of some of the like oppression that we see like in current times, but it was based during the Revolutionary War. So anyways, I love him.
I'm definitely in the minority of not seeing it.
That's probably my answer.
Okay, good answer. Lastly, this is an easy one. What do you like to do just in your free time? Hobbies? Improv's one, obviously.
Improv. I like to exercise. I feel like, as we already brought that up, that's a huge stress relief. I watch a lot of SNL. I like finding new places to get tacos.
Okay.
And
we'll talk about that after the show.
Wine and margaritas.
Okay. Well, you heard it here again. Thank you for coming on. This was a lot of fun, and thank you all for listening. Again, we really appreciate the support, feedback, positive, constructive. Just thank you so much. I had someone in improv today, not Hannah, but someone else just be like, yeah, I've been listening to your shows. I actually really like them. And it's like, if that's the case, if you're listening, please tell me, because that makes me feel just so happy, and I'm so glad. So thank you all again. We're going to sign off here. MD, you got anything you want to say to the listeners before we head out?
No, it would be redundant. Just echoing the gratitude, I think, not just for the people listening and voicing it, but for people like Hannah who can come volunteer their time and open up about parts of their life that again are uncomfortable. And I think maybe not so uncomfortable for you at this point, but generally I think uncomfortable deep beneath the surface, we just met an hour ago, right? So a lot of gratitude for you today, and I think that's what I'm looking forward to as we do this, is more and more just getting to know people to that level.
Yeah. Thanks, guys. We're going to sign off. Till next time.